Welcome to Chapter 6, Clinical Documentation Improvement. In the learning objectives today, we will identify discrepancies between supporting documentation and coded data. We will develop appropriate physicians' queries to resolve data and coding discrepancies. We will implement provider querying techniques to resolve coding discrepancies. And we will also create methods to manage present on admission, hospital-acquired conditions, and other CDI components. So let's get started. This chapter explores the clinical documentation improvement and health information management function, as well as the HIM professional roles, and how it has evolved from keeping health records to facilitating how health care information is organized and used. HIM professional roles in clinical documentation include providing tools and processes to improve work, assisting clinical staff in assessing and using information, and completing documentation on time. HMI professionals, they also do just so much more, such as they develop and use best practices as they relates to data quality. They also are professional in their role. They help implement systems and processes that permits timely access to clinical data. And they advocate for quality documentation and data to improve patient care and safety. The ultimate purpose of CDI program, and this is what we're going to talk about very extensive, right, is to ensure that physicians provide the most complete, clear, reliable, timely, legible, and precise documentation, and documentation meaning information, consistent with the clinical findings being that data in the medical record. Now, a successful process will reduce the amount of conflicting, incomplete, and non-specific clinical documentation. So a CDI program includes a review of patient records while the patient is still in the hospital to concurrently identify any opportunity for improvement in the clinical documentation. With the transition to electronic health record, documentation reviews previously performed by clinicians or clinical documentation specialists alone can be enhanced by clinical decision support systems. It can be improved by alerts and other automated clinical messaging. Clinical documentation is any manual or electronic notation made by the physician or other healthcare clinicians related to the patient's medical condition or treatment. Clinical documentation is the primary means clinicians use to communicate their opinions about a patient's condition and decisions about how to treat the patient, and the primary purpose for the patient health record. Since coding professionals also use clinical documentation to determine which codes to assign to a patient's record, detailed clinical documentation is essential and the basis for ICD-10-CM, ICD-9-PCS, and CPT coding. Because clinical documentation in patient health is highly regulated, the theory must begin with regulatory and legal requirements. Now, Medicare condition of participation require that all healthcare providers maintain patient health records and that they dictate certain content, including information to justify admission and continue hospitalization to support the diagnosis, as well as describe the patient progress and response to medication and services. So the minimum compliance should be complete and legible. Past and present diagnosis should be accessible. Risk factors identified. The rationale for ordering diagnostic and ancillary services should be documented or easily inferred. The patient's progress and response to treatment and any revision in diagnosis should be documented. Documentation of patient's encounter should include the reason for the encounter and any relevant history and findings. So now we're going to talk more about the critical or criteria for high quality clinical documentation. So if a physician are trained in the 7 criteria for high quality clinician documentation, the quality of their clinical documentation will improve. The 7 criteria for high quality clinical documentation requires that all entries and the patient record be first, legible, reliable, precise, complete, consistent, clear, and timely. And we're going to dive more into each one of these. So let's talk about legible. Legible, so what is it? It's when it's clear enough to read and easily deciphered, right? The inability to read a record entry is usually due to the fact that the physician handwriting is indecipherable, right? Legibility is a clinical documentation requirement by every regularly body and law that addresses health record content. An illegible handwriting is usually the result of a rushed or a careless documentation practice. Reliable, trustworthy, safe, and yielding the same results when repeated. This criteria is related to treatment provided to the patient and whether the physician's documentation supports the treatment. For example, I assume that a physician's order a blood transfusion for a patient who has the upper gastrointestinal bleed and severely low hemoglobin and hemocratic levels, right? The physician diagnosis for the patient is a bleeding gastric ulcer. The physician diagnosis of the bleeding gastric ulcer does not appear to be reliable based on the treatment given, as blood transfusion is not an accepted treatment for a gastric ulcer. If the physician document bleeding gastric ulcer with acute blood loss anemia, if clinically indicated, right, based on the treatment given, then this is a reliable diagnosis. Precise, accurate, exact, strictly defined. The more detailed the physician documentation, the more representative and accurate, right, the clinical documentation in the patient's record is likely to be. Complete, has the maximal content, is thorough. Complete meaning at the physician is that the physician has fully addressed all concerns in the patient record. Completeness also includes the appropriate authentication by the physician or clinician, which generally includes a signature and the date, whether on paper or electronically. Clear. So when we think about clear, it's not contradictory, right? Vagueness, ambiguity, when we talk about clear, exists when the clinical documentation does not fully describe what is wrong with the patient. So this may result in the documentation of symptoms without etiology or possible etiology. Timeliness of clinical documentation is essential for the best treatment of the patient. The EHR can help with timeliness, but the clinician's input is still necessary. In addition to daily progress notes, entries, and timely discharge summaries, physicians also need to be timely with diagnoses and are present on admission. And present on admission, documentation impacts research, reimbursement, quality indicators, and planning. So this ends this part of our session.